Welcome to NURS 2701 Nursing Orientation. I've prepared these few short video clips to help you prepare for this very busy week that we have coming up. I'd like to take this opportunity to welcome you to Adult Health Challenges, our orientation days. The day one of our orientation will be located at the Best Western Hotel, and that's near the GO Station in South Oshawa. If you could please upload to your laptop and bring your course outline, your practicum handbook, the practicum orientation package, a copy of your last clinical evaluation, a drug guide, your lab reference guide, bring a blank worksheet, and your electronic device or cue cards. Day one, and this is taken directly from the Orientation Winter 2016 workbook, and that's posted in Blackboard. So we'll start at 8 o'clock, and the day will actually be 8 to 4. The morning, so 8 to noon, will be spent at the Best Western. And we're just going to go over some of the things that will be important as you progress through Adult Health Challenges. We'll look at discussing some tips for success. We will do a CPR review just so that you can refresh your skills. We'll have some paper-based scenarios. So what do you do if, and one of the examples, if a patient's fallen on the floor, what would your first actions be? So we discuss some of these things that you may not be familiar with so that you're prepared to when you go into clinical. We will be having a break, and that's the coffee and tea have been provided by the hotel, so we're very grateful for that. But please do bring your snacks with you. I'm not sure about the food that might be available. Then we'll also be discussing the paper documentation that will need to be submitted for clinical. So that will be the learning plan, the reflective critical analyses, and the praxis progress record. So we'll be providing you with some samples as well as some guidelines around the learning plan, the RCA, and the PPR. Documentation, so the charting station, and that will be both electronic and paper-based. And I have to also say that even though if you're at Lakeridge Health, you will be doing electronic documentation, and your clinical instructor will go over some of the particular nuances or the particular pieces on that unit. You should be prepared to do narrative as well. I've had the opportunity when the electronic documentation, there was a glitch in it and it failed. We had to go to paper-based charting. So you have to be prepared to go to narrative like they're doing at Rouge Valley. There'll be the opportunity to review the practicum handbook, and that will be really important information for you to know pretty much cover to cover, and we do get you to sign off so that you'll know things such as that you need to attend all clinical days. If there's any clinical absences, you have to provide a doctor's note. You have to contact your clinical instructor, and there's a way of notifying for absences. During the lunch break, so we will break for lunch, and during that time we're going to then relocate to our practicum site. So that will be one group will travel on to Rouge Valley, and the other groups will travel back to Lakeridge Health Oshawa. We'll meet the clinical instructor on site, and we will then go on a unit tour and discussing with your clinical instructor some of the practicum expectations. They'll be talking about the post conferences, and again, post conferences at year 2 will be used for debriefing or maybe bringing some questions that you needed some points of clarification, discussing some of the learnings that you might have had for that day. Parking, and again, both sites are paid parking, so you might want to put together some people to commute with so that you can cut down on your parking, but it is you will be charged for parking, and commuting to your practicum sites is the student's responsibility, so you might want to get a group together and commute together. You'll need to develop a phone chain with your clinical instructor, which has the clinical instructor's name and then all the people in your group's names listed with their telephone number. And I always, when I do my fan out sheets, is what these are called, I always get the people that are called closest and then those that are furthest, so that you can, if you're notifying, if I was notifying in case of a disaster, I would want those that are closest to come back to the hospital quickly. But in your case, I would want to notify those that live closest or live furthest away, so that you want to make sure that if there's absences or whatever you want information, that they haven't left already. So you'll have your fan out sheet, your submission of documents. So what dates do your clinical instructors want to see your learning plan by, your RCAs and your PPRs. You'll have your worksheets and what's the expectation of the clinical instructor. Practicum evaluations, you can share your final sheet with the practicum, your clinical instructor, but also you can look at the practicum evaluations in more detail. And it's really important that you provide lots and lots of examples when you do your self-evaluation, because that way, when it's signed off, when it goes to subsequent years, you can demonstrate you've already accomplished entry to practice competencies number 35 through 45. So if it was ever a discussion, you can say, well, no, I was competent here. So it just really supports you in your practice and what you've already accomplished. It will also be an idea of where you might need to have some further assistance or do some further review. You'll need to bring your lab and diagnostics, and so just what is that area that you're going to, and so what are some of the common labs and diagnostics that you'll see in that area, as well as the common diagnoses. Patient teaching, and I can't emphasize that will be so important to do patient teaching. And you'll also have to pull in your patho and pharmacology. So these are all things that you will be talking about with your practicum instructor. Day 2, we're going to be meeting in J121 to get our group assignment, and then from that we'll be broken into our groups, and we'll be rotating. There will be several groups in J121 and then several groups in SW207. If you could please bring your stethoscope, bring your kits, and that includes your pharmacology kits and your sterile asepsis kits, dressing trays and catheters, and IV piggybacks and IVs and whatnot. Bring your drug books and any references that you might take to clinical. And that could include your electronic devices as well. Year 2 is part of the iPad mini trial, and so you'll have the opportunity to have an iPad for the semester. And so we will have from 8 till 10, we'll have the iPad pickup and a short orientation to the iPads. And then each group will have the opportunity to rotate through the stations. So there'll be one station that's paper-based case studies, and you'll go through those. And that's going to be taking place in that room at the end of the hall beside the sim lab. We'll have one of the clinical instructors facilitating just plain case studies that you can go through and help really get you to think at a different level. When you go into the lab, there'll be the simulator set up in cases of 2 and in pairs. So you'll have one will be Mr. Dressup or Mrs. Dressup, and one will be Mr. Mitchell. So there'll be one surgical patient, one medical patient, and that information for you to prepare is in the orientation file under simulation day, and that you'll have 2 patients there. So really focus on your comprehensive assessment. So you'll need to do a head to toe, and that will help you get refreshed for going out to clinical. Then the next pair of patients will be sterile asepsis. And so you'll have the opportunity to either put in a Foley catheter or do a dressing, or if you would like both. The next station will be around prioritization. So that is really part of the role of the RN. And so this will be an opportunity for you to think about how would you prioritize. So which patient are you going to see first and why? Talking a bit about what sort of health teaching would you have for these 2 patients. So a medical patient and a surgical patient. They're in J121 back in the classroom. There will be 2 stations there. One will be on parental therapy, and that will be also flushing IV saline locks as well as DCing IVs, so that you can do that when you're in clinical. And there'll be some health teaching station. We'll bring out some drains, etc., so that you'll have the opportunity to look at that as well. So you'll be attending the simulation lab in small groups. You'll be providing care for 2 patients, so a post-op patient, below the knee amputation, and a cardiac patient. And so just as a reminder to wear your uniform. These are the cases that you will have for review, and these are taken from the Practicum Orientation Simulation Lab session outline, and that's in Blackboard. So Mr. or Mrs. Dressup, MI congestive heart failure, and there's the case scenario, or Mr. Robbie Robertson, and he's a below the knee amputation day 1. And so just giving you a bit of history there for that patient. Again, just wanted to let you know that about the iPad trial and all the opportunities that you'll have with this iPad. We are very interested in knowing your perspectives of the use of this technology in clinical, as well as in the classroom. And that one of the assignments will be around apps for the iPad. Although the actual research piece, the participation in the focus groups and survey will be all voluntary, and we're going to have our first focus group on Friday afternoon. And so yes, we're just going to conduct our first focus group Friday. So I just wanted to let you know that that's sort of how the orientation will go. This is all to support your learning. There's no evaluation component to this. I do hope that you will take the opportunity to review some of the things that you might have gotten rusty over the last, haven't been exposed to maybe catheterization for the last 10 months, so you might want to go into the IPR hours and to practice catheterization and to review some of the pieces that you might be using, some of the skills you might be using for adult health challenges. So this is all to build up your confidence and to help you to be more confident in your assessments and in your knowledge when you go into clinical. If there's ever anything that you are unsure of, you're to take that to your clinical instructor. You're to look it up in the unit manual or the online policy and procedure manual, but really to get that to know what you don't know, and if there's something you haven't seen before, you take that right to your clinical instructor so that you can have guidance on how to manage it. So I know that some of the students were not familiar with heparin drips, and so they needed to bring that information to me as a clinical instructor so that I can provide guidance on how to run those clinical drips, because it's all about patient safety. I look forward to seeing you in clinical or in practicum.